drug is one of the combination of many drugs, especially given to the people or indicated to the people who are very artistic, people who are very talented, people who take up responsibility very early age, people who are highly sensitive. They get offended very easily. This is not Natramure, this is not Ignatia, this is not Staphylos aureus. The person was basically an inferiority complex. They will never show their real talents. Most of the time they remain suppressed. They suppress their emotions. They suppress their feelings for the sake of others. It is not magnesium. They lack the courage. They lack the boldness. They have got marked anxiety, anticipatory anxiety. This is not Silesia. This is not Lycopodium. This is not Gelsemium. They have got marked fear of exams. Again, this is not Gelsemium. These are the people who have got marked fear of thunderstorms, like phosphorus, but this is not phosphorus. They watch thunderstorms. They are the people who love traveling. They are the people who are like a cosmopolitan. They always travel. They enjoy the nature. Again, this is not phosphorus. These are the persons who have got peculiar craving for chocolates. These individuals had an history of bad childhood, or they had been abused by parents, or they have been abused by siblings. They have been discriminated in the childhood. This is not magnesium again. This is a nosode, especially given with a strong family history of cancer, family history of tuberculosis, family history of diabetes, and this drug is carcinosin. Carcinosin. It's also called as carcinosinum, cancerinum. Carcinosin is a nosode, a medicine prepared from the deceased product, a nosode from carcinoma. There are many provers. If you see in the hierarchy, the first prover is Dr. James Taylor Kent, later on by James Compton Burnett, then J.H. Clark, and latest by Donald Fovister. Carcinosin is always a difficult remedy to understand. Partly this is due to the lack of information on the remedy. If you open your Borik's textbook, or if you open your Clark dictionary, you have got only few symptoms. But at the same time, if you open the latest textbook of Metrimedica, we have lots of symptoms. Why it is so difficult to understand? Partly it is due to the fact that much of the information found was contradictory to itself. Partly it is because the information is so much that many times it gets confused with similar remedies. Sometimes symptoms of carcinosin looks like Natramure. Sometimes it looks like, in some angles, it looks like phosphorus. Sometimes some symptoms looks like Staphylos aureus, magnesium mure. Some symptoms looks like lachesis, tuboenum. So we get confused. Because of this confusion, some homeopaths prescribe this remedy rarely, whereas other homeopaths prescribes it daily. But both cannot be right. The intense disparity within the remedy seems to make it is so confusing. So let us see some more deeper part of carcinosin. Let us see some of the historical background of Carcinosinum. The first to mention and use Carcinosin, the cancer nosode, was James Taylor Kent. He called this carcinosin as carcinoma. The medicine name, he called it as carcinoma. And we'll see how he prepared this carcinoma medicine. The preparation of carcinoma which he used for years was taken from a mammary cancer, a breast cancer. The patient had continual seeping of clear, colorless, watery discharge from the open cancer. A small quantity of this fluid was saved and potentized and has served satisfactorily in many cases of advanced carcinoma. He used it as a palliative in cancer cases. The details of that is mentioned in Kent's New Remedies, Lesser Writings, Clinical Cases, Aphorisms in the page 523 of Lesser Writings. Later on, the English homeopaths James Compton Burnett and his well-known colleague Dr. J.H. Clarke were the next to do research and practice in the field of cancer nosodes. They used Syrinum primarily, which is said to have been taken from the hard cancer, Cirrus. In the 19th century, these two homeopathic physicians proved the efficacy of carcinosin for the first time. Later, Dr. Donald Fovister is the one whom the homeopathic community owes the rediscovery of these remedies. In 1952, he noted that children whose mother had cancer during pregnancy exhibited a certain appearance consisting mainly on the blue sclerotics complexion and numerous black circular moles. Those parents who had cancer and those children born from the cancer mother had a blue sclerotic changes and numerous black circular moles on their body. This made him to wonder whether this appearance had its origin in mother's cancer. He began to collect similar cases and to prescribe carcinosin for those of the patient who had this characteristics family history of cancer with considerable success. And this is how the history goes about carcinosin, starting from James Taylor Kent, then Burnett, then Clarke, then Fobister. Regarding the preparation of carcinosinum, the homeopathic remedy carcinosin is a nosode, a remedy developed from the same material which causes the disease. In this case, it is a cancerous tissue obtained from the mammary gland. So the medicine is prepared from the carcinoma of the breast. The diseased tissue are sterilized and dissolved in purified water. Subsequently, the blend is diluted and succussed repeatedly. The end product of is the homeopathic remedy carcinosin, which does not retain the slightest trace of the diseased tissue and it is safe for use. Details of that preparations you can have a look about pharmacopoeias. Regarding the sphere of action of carcinosin, this drug has got main action on central nervous system, especially it has got action on the brain at the emotional sphere. It also has got action on gastrointestinal tract. It has got action on the blood, skin, mucous membrane. These are the various sphere of action of carcinosin. Regarding the miasmatic background, carcinosin covers all the three miasm. It has got psoric feature, it has got psychotic feature, and also it has got syphilitic miasmatic background. We'll see some of the keynote indication of carcinosin. Before going deeper into the keynote indication, I would like to tell, especially for the beginners, many times the symptoms looks like other polycrest remedies. So you shouldn't get confused. You may see some key symptoms of phosphorus. You may see some keynote symptoms of natromure. You may see some symptoms of ignatia. You may also see some symptoms of magnesium. You also see some symptoms of staphysagria. So you have mixture of symptoms in this deep acting nosode remedy. The first key indication of carcinosin is regarding the anxiety. The person is a great anxious person. There's a marked anxiety, especially in the form of anticipation, anticipatory anxiety, like our lycopodium, like our argentum nitricum, like our gelsemium, like our aconite, like our arsenic alb. Especially, person is anxious about the health issues, anxious about the diseases, anxious about the future, like our silesia. Person has got marked fear of cancer, like our calcarea carb, fear of health issues, fear about his sickness, not only his sickness, fear of others' disease also. Person has got marked fear in a crowd, like gelsemium, like our kali carb. Fear in narrow places, like argentum nitricum. Person has got fear in the high places. Person has got fear of spiders, fear of insects, mice, fear of snakes, fear of failures, especially in the exams. Person also has got fear of thunderstorms. At the same time, person wants to watch thunderstorms. Both are there. Fear of thunderstorm and also wants to watch thunderstorms. These are the few symptoms in relation to the anxiety. Second key indication of carcinosin is regarding the eyes. You can see in this image, blue sclera. The white portion of the eyes, it will be more of bluish or more of darkish in color. That is the key indication of carcinosin which Dr. Fobister is observed. The third indication of carcinosin is regarding the person's very fastidious and perfectionist. Both are seen in this remedy. We have some remedies for fastidiousness like arsenic alb, like naxomica. Naxomica is more of irritable fastidiousness. Arsenic alb is more of a cleanliness fastidiousness. We have perfectionist also seen in this remedy, like our lycopodium. Even sulfur is fastidious. The perfectionist and fastidious nature is a very important trait in this remedy. If you see cancer, so cancer is an expression of disorganizing action of diverse external influences. This disorganization, perfection, and integrity are the main theme in carcinosin personality. In carcinosin persons, they have a strong family history for our prescriptions. Most of the time, people have prescribed carcinosin blindly for the people who had a family history of malignancy in the family. So any person who comes to the clinic saying that with history of carcinoma in the family, people used to blindly prescribe carcinosin, but that is wrong. You need to understand a trait of person. So family history is a very important part in carcinosin prescriptions. Whether they have a family history or personal history with addictions, especially addiction to the alcohol. Whenever there is a drug addicted or cigarette addiction or caffeine addiction, or family history of tuberculosis or family history of cancer, family history of diabetes, family history of mental illness, family history of obesity. All these are the one of the indication and keynote symptoms of carcinosin. Don't blindly prescribe carcinosin only based on the history of malignancy, but you can also see other histories which also may help you for prescription of carcinosin. Regarding the desires, which is again a peculiar key indication of carcinosin, is person has got marked desire for chocolates. Not only chocolate, person also has got marked craving for butter, craving for coffee, craving for sweets, craving for fruits, craving for milk, craving for meat, craving for fatty meat. All these cravings not only craves, but this aggravates the person. And it is not only cravings, you may have just opposite of these cravings, there is marked aversion also you can see in the same person. So there is a desire for chocolates, and there is also an aversion to chocolate, but predominantly desires are chocolates and butter. So you have both extreme symptoms you can see in carcinosin. Another indication of carcinosin is person is highly sensitive to the wheat products. Whenever the person takes wheat products, he may get constipated or he may get some skin rashes. Highly sensitive to the dairy products leading to urticaria, dairy products leading to some respiratory complications, or dairy products leading to some GI complications. These are the few keynote indication of carcinosin. Another indication of carcinosin is there is a history of dominated parents, history of abusive in the family. This child or this person had a very traumatic history in the life. The person has been mentally disturbed because of this incident in his life. Maybe your parents are quarreling, maybe parents are separated, or history of dominated parents, or history of abusive by the siblings, history of not only abusive, even the abused by the loved ones. Even there is a history of sexual abuse. All this will help you in prescription of carcinosin. That is one of the key indication in carcinosin personality. There is a childhood abuse, there is a sexual abuse, there is a dominated parents. You have many such individuals are coming in our clinic present days. They may not tell in the beginnings. This person will never reveal unless you have a sensible questioning and try to understand why this person has this problem. When you analyze the case retrospectively, you may get the symptoms. A very close coming remedy is magnesiums. You need to rule out magnesiums. You need to rule out carcinosin with this symptom. Another indication of carcinosin is history of early responsibility, especially as a child. You can imagine a child where parents are separated or the child has been adopted. You can see when there is such symptoms, you can analyze in the life history, the person has taken up the responsibility in the early age, or parents are not there. This person is taking a responsibility of his brother or sister. There is a early responsibility in the life, which is a key symptoms of carcinosin. There is a rejection from the parents. There is a rejection from the siblings through the death or separation. That is the significant point in carcinosin personality. Another key symptom of carcinosin is there is a history of suppressed anger. There is a history of humiliation. This person has been frequently insulted in a group or insulted in the family. And this anger which has been insulted by the others, he is unable to express because he feels that he has been rejected. This anger is usually suppressed. This humiliation which this person underwent in his throughout the life, which is again a suppressed. The most close coming remedies are staphysagria, some extent even magnesium. They usually hold back their emotion, like our natrum. They loathe being censured or scolded, and they get offended very easily. They don't express that emotion. If you see a psychosomatic profile of the patient suffering from cancer, usually reveal a traumatic childhood. Although in their later life they claim it would be uneventful, a rejection from the parents or rejection from the sibling or through the death or depressions, all that thing is one of the key indication of carcinosin prescription. Carcinosin people, they are highly sympathetic for the suffering of others. Again, I have said this is very similar to our phosphorus, very similar to causticum, very similar to natrum. People who have marked anxiety for others also, they are highly sympathy, they will try to help others, they try to guide others, which is there from the childhood, this nature. Now question is how to differentiate phosphorus, how to differentiate causticum. Phosphorus personality is totally different type of personality. Person is very bold, person is highly expressive, whereas carcinosin is most of the time suppression. Phosphorus is expressive personality. If we see causticum personality, they will fight for the others, they will fight for their rights, and they cannot see injustice happening for the others. They'll try to fight. That is causticum. Phosphorus is very bold, active. They are diffusive. Whereas carcinosin, it is not like that. They are most of the time suppressive, which is there from their childhood due to various traumatic history. So that's how you can differentiate sympathetic nature of phosphorus, sympathetic nature of causticum and carcinosin. They have impulsive compassion towards the others. We'll see another symptoms of carcinosin is the person is highly vulnerable. The person is highly oversensitive, highly sensitive to reprimands, very sensitive to rudeness of others, very sensitive emotionally for everything. If you see, sensitive is a so broad terminology, but we need to be further qualified. We have every drug is sensitive. Natriuretic is sensitive, Silicea is sensitive, Hepasulf is sensitive, Noxomica is sensitive. The expression of sensitivity of these drugs are totally different. Noxomica has got various different expression. Silicea has got different expressions. So whereas our carcinosin is highly sensitive, especially about somebody's insulted, somebody's rudeness, someone is not well. It is more of obsessive, it is more of sympathetic, it is more of suppressive, which you can see in carcinosin. Carcinosin personality has got marked desires to be travelled, cosmopolitan. They never stay in one place. They keep on traveling. They likes to travel. They wants to be with nature. They love watching sunrise. They love watching sunset. They love watching rivers. They love watching the mountains. They love watching clouds. They love watching thunderstorms. Even though they get scared, but they love. They are the nature lovers. That gives some kind of amelioration for carcinosin personality. They want to be near the seaside. Seaside ameliorates most of the complaints. They want to be travel. It is like a thrill for carcinosin personality. Carcinosin persons are highly talented people. They are highly artistic. Usually such people feel well when they go for dancing. When they listen to the music, most of the complaints is relieved. They are highly artistic personalities, like our phosphorus, like our silicea, like our noxomica. Children who need this carcinosin remedy are not only intelligent, but also have an artistic nature, like they have extreme characteristic from their childhood. They have fond of music, they are fond of fine arts, they are fond of drawings. So you need to differentiate our prosperous to some extent, like Lycopodium, Silesia, in regarding the artistic nature of Carcinosin. One more modern trend in homeopathic prescribing is especially cases of ADHD or cases of autism or cases of mentally retarded children. People used to prescribe Carcinosin. Whenever there is a family history of autistic children or family history of ADHD children or family history of mentally retarded children, people used to prescribe Carcinosin. So currently this is a trend, but that is again a wrong. You need to understand the entire life situation of the person. You need to find out the family history. You need to find out personal history, and you have to match a totality and prescribe a indicated remedy, and should not blindly prescribe based on the disease. Another peculiar keynote symptom of carcinosin is regarding the sleeping habit. Most of the time, carcinosin person feels better by lying on the chest. They'll be lying on the abdomen, like our Sina. Most of the symptoms are relieved and they feel comfortable by lying on the abdomen or lying on the knee chest position. That is a peculiar, you can say that is a peculiar observation in carcinosin patient. Another symptoms of carcinosin is they love watching thunderstorm. Even though they got fear of thunderstorm, but at the same time they likes to watch thunderstorm. That is again a keynote indication of carcinosin. We will try to understand carcinosin personality at various levels. Basically, carcinosin person is highly sensitive. I have said the sensitive is too broad. Carcinosin person is highly vulnerable at the extreme level, at the emotional level, or at the mental level in general, or even at the physical levels. They are highly vulnerable. As a consequence of vulnerability, they cannot stand any kind of reprimand. They cannot stand any kind of rejections. They get easily offended. They cannot stand any kind of disapproval. They are the people who wants everything in a neat and order, seeks order and seeks control. They want something neat and clean. Very fastidious person, very perfectionist person becomes highly fastidious, and at the same time they are highly sympathetic. The person is highly compassionate, feels acutely pain for others. Horrible things affect them profoundly, but at the same time they don't have the confidence. They lack the self-confidence. They want to please everybody. They cannot say no. They feel guilty sometimes that they have not done. They are highly vulnerable at the various levels. In short, you can say carcinosin person who get hurt very easily. They have a strong fear of humiliation. They have a strong fear of insult, like our Staphylos aureus. Even a small critics, which will go to extreme level of mental shock for carcinosin person. But he will not express that. He will be suppressing it, and finally it will go to the deeper organs. Sometimes this shock may go to an extreme level of hysterical behaviors. They may weep, they may sob, and they may have physical expression like they have sudden breathlessness. Because of this mental reason, they have weeping and sobbing, and finally they become breathless. They become turning blue. Smallest things get offended very easily. As we said already, that carcinosin person is highly sensitive. This sensitivity of carcinosin is further qualified that this person is most of the time remains in a state of constant unhappiness. Constant unhappy. They are not at all happy because various incidents happening in their life because of their basic sensitivity nature. The grief and sorrow comes easily in their lives as they are so easily affected by hurt. Grief in carcinosin does not necessarily come from a great and substantial calamities like many other drugs. We have natramure grief due to some reason, maybe death of near and dear ones. Ignitia, maybe disappointed in love or disappointed in relationship, in ignitia grief. But grief of carcinosin does not necessarily due to anything. This grief is almost there in every day in carcinosin personality's life. Because of this sensitivity nature of carcinosin may make difficult for others to live with this person. This causes them tremendous pain for carcinosin. After a number of years of this grief, this patient develops severe symptomatology due to compound grief or compounded grief. It is not just one grief. There are everyday grief. Every day is getting hurt, every day getting humiliated, every day suffering because of basic sensitivity nature. And this will be, all this grief will be in a combined as a compounded grief. We have ignitia, natrum, pulsatilla due to one or two incident in their life. But carcinosin is not like that. Everyday life is like a grief for carcinosin. This kind of grief that they will not discuss, they will not complain, they will not show it out. It can be said, in other words, is a silent grief, like our ignitia. Not an hysterical type of ignitia. In this state, carcinosin appears to be very similar to natramure, a remedy which shares other symptoms as well. But this grief of natramure is totally different in its origin and different in its quality. The carcinosin grief has its source in a sense of weakness of will. Carcinosin doesn't have that willpower. Carcinosin person is not wanting to confront others. Carcinosin person is not demanding and not asking for things. That is the reason for their grief. Person doesn't have that much guts. Person doesn't want to confront others, doesn't want to demand, doesn't want to ask anything. That is the reason why they get hurt. In a propensity to accept rather than demanding. He'll accept everything, whatever happening, he'll accept. He is not at all demanding. The grief of natramure or ignitia, on the other hand, has got more deeper feeling in that. There's a great loss of loved ones. That could be a reason for grief in natramure or ignitia. Grief that constricts the emotions. You have natrum and ignitia. In natramure, he will demand. Ignitia is again demanding. But carcinosin, there is no demanding at all. Carcinosin person keep quiet because they are so much afraid to disturb others by their complaining. They doesn't want to disturb others by their complaints, like our magnesia. So it is actually a state somewhat between staphysagria, somewhat between natrum, somewhat between magnesium. So more of repression of emotions, which is you see in carcinosin. Another mental trait of carcinosin is submissiveness and repressed. Basically, a carcinosin person has got marked fear of rudeness of others. As their defenses are compromised, they are unable to face the aggressiveness of the world, which is seen from their childhood. They are most of the time submissive. Their feelings are repressed as a child. These children are well behaved children. These children are easily handled children. They are the children who are over adapted. They are very kind, very obedient, very helpful. These children, they please their parents. But these children have never been able to express their own individuality. They cannot be themselves because they got marked fear that others will not accept them. They have a fear that others will not appreciate them. So because of this marked fear of unacceptance, fear of not appreciated, so most of the time they will remain in a submissive state and they have a kind of insecurity feeling, like our natrum. They lack the confidence. There's a lack of self-confidence in this type of personalities. They do not believe themselves. Even though they are capable, but they do not believe themselves, their capacity. Any emotional stress or any conflict situation makes them sick. So most of the time they avoid such situations. They don't go forward. They do not go for any arguments. They avoid conflicting. As a child, this child avoid conflicting with other children. They will tolerate other children. So most of the time they will lose their toys. Other children will snatch their toys. So such kind of person, as a child who doesn't have a confident, so same personality develops within them, a kind of insecurity, a kind of fear, a kind of lack of self-confidence, a kind of submissiveness. All their feelings are repressed. But they are very orderly, they are very fastidious, but they are also a perfectionist. The strong sense of order they possess compels them to become a very tidy. Children may clean their rooms perfectly, they keep their books very meticulously, they keep their clothes in perfect order, they line up their toys very neatly. So they grow up with this constitution. They'll do their work neatly. And because whenever they are unable to do that, they have that guilty consciousness that I have not done things. I have not done perfectly. Even though it is very perfect, but they have that guilty consciousness that I have not done perfect. They want to be busy most of the time because of this fastidious, because of their obsessed or perfectionist. Another basic trait of carcinosin is the person is basically an anxious person. The anxious is a too broad terminology, which is further qualified that they are highly anxious in more of anticipatory type of anxiety, which is further qualified is more of fearful personality, like our aconite, like our calicab, like our lycopodium, like our gelsemium, like our argentum nitricum. They are more of anxious, more of fearful person. There's a marked anticipatory anxiety with fear of failure, especially during examination time, like our gels and argentum nitricum. But gelsemium anxiety is more of leading to a diarrhea. Gelsemium anxiety leading to dullness, dizziness, drowsiness, which most of the textbook describes. But this anxiety is throughout you see in Carcinosin personalities. The anxiety in Carcinosin is mainly because there is a fear of humiliation, which we already seen. There is a marked fear of insult. There is a marked anxiety about the future. There is a marked fear of cancer. There is a marked fear of failures in life. Marked fear of failure in examination. Person has got fear of height. There is also fear of narrow places, claustrophobia, like our argentum nitricum, lycopodium. Person has got marked fear of busy streets, fear in crowd, like again aconite, calicab. There is a fear of animals, which is frequently seen in Carcinosin individuality. Person has got marked fear of dogs, fear of cats, fear of birds, fear of disgusting animals. There is a disgusting mixed with fear, which you see in Carcinosin. Person also has got fear of frogs, fear of snakes, fear of spiders, fear of all sort of insects, bees, wasps, and so on. Person also has got marked fear of ghost. But person has got curious or attracted to hear the stories of ghost. These are the two things, extremes you can see. There's a fear of ghost, and also person wanted or curious to hear the stories of ghost from the childhood. There's a marked fear of thunderstorm. At the same time, person enjoy watching thunderstorms. There may be an attracting towards the animals, which you also see in Carcinosin. They love animals, like our Medorinum. So both they get fearful, but at the same time they love animals. These are the few of the mental trait of Carcinosin. Carcinosin person is highly malleable. Malleable means they get adapted very easily. They get molded very easily. They get influenced very easily by others. It means you are able to hammer or press into any shape you want without breaking or cracking it. That is the meaning of malleable. They are highly influenced by others. They are highly pliable, highly yielded. Whatever way you want, you can make Carcinosin person from their childhood. They'll never express their emotions. They get attracted. They just blindly follow their parents. If the father is very fastidious, naturally this Carcinosin gets that trait. Carcinosin is highly intelligent, highly conscientious, very sensitive. They are the people who are easily influenced by the parents. They get adjusted as the wish of parents. They are very good in adaptability. So they become a very good drawing artist. If at all, if they get into a bad company, they may become a destructive. They may become disobedient. They may become kleptomaniac. So all these are influenced by someone mostly in their life. That is the meaning of malleability of Carcinosin. If they get a bad company, they may become bad. If they get a good company, they may become good. That is a Carcinosin, one more trait. One more very interesting mental symptom of Carcinosin is precocity. As we said earlier, that these children are molded by the parents or someone. They have got very good adaptation. All the parents want their children to be a good boy or good girl. So they get adapted. they get impressed by their parents. So these children are very precocious children. They are very social. They got very strong sense of responsibility, particularly from the childhood. They are the people highly industrious, highly intellectual. They want to be very sympathetic. They have the power of adapting to the situation. They are very cautious, very censorious. They are the people who take care of others without complaining. They'll take care of their parents, they'll take care of their siblings with the marked anxiety for their health. They got marked anxiety about their loved ones. They got marked anxiety about the family members. All these things you can describe based on the one symptom, that is a precocity. If you see some of the desires and aversions of Carcinosin, which are very interesting if you see in a repertory: food and drinks, coffee desires. At the same time, that aggravates. Food and drinks, egg desires, again which is aggravating. Fruits desires, that aggravates. Meat desires, that aggravates. Milk desires, that again aggravates. Food and drinks, rich food desires, which is again aggravating. Food and drinks, salt or salty food desires, which is again aggravating, which is similar to natremure. Food and drinks, wine desires, which is again aggravations. Sweet desires, which is again aggravation. So you have many desires, but that desires are aggravating in Carcinosin patient. You can see a summary of Carcinosin in this slide. You have a center core is malleable. These are the individual who get influenced easily by others. And person is highly sensitive, which you have studied in detail. Person who get hurt very easily. The person get affected very easily when someone is insulted. The person is very precocity. You can mold them in any shape. The person who is basically an artistic person, very fastidious, perfectionist, obsessed. And if at all he is in the bad company, he can be a destructive. There are many desires, but all those desires are aggravating. This is in short a summary of Carcinosin.